Hey everybody, thanks for joining us on the Shift Health Coach podcast today. Today we've got a special guest joining us. Her name is Dr. Chamoun, and she is a double board certified lifestyle cardiologist with over 20 years experience. She serves as a co-chair of the cardiology section of the American College of Lifestyle Medicine. Dr. Chamoun is the founder and president of CardioSeeds, the company that provides strategies and solutions for burnout-free, value-based healthcare. Dr. Chamoun is also the creator of the CardioSeeds radio podcast that is all about lifestyle medicine and providing provider burnout mitigation. So I want to thank so much for her joining us today. And today we're really going to talk about that physician and provider burnout. So many of us know that the difficulties right now, trying to see the doctor, having some doctor time. And I know so many of us that are outside of the healthcare provider world, we get very flustered, very agitated because it's becoming such an issue in getting proper care. But today's going to give us the flip side look into that because it's frustrating for us. But what we forget is that there is major burnout on the provider part. And a lot of times we see it with nurses. But today we're actually going to talk about that on the physician side with Dr. Chamoun and really have an understanding of some of the struggles that a lot of our providers are currently facing when it comes to burnout. So I want to thank you so much for listening to the podcast or watching us. And I want to welcome Dr. Chamoun to the show. Okay. Well, thank you, Dr. Chamoun, for joining us. I am so glad you have the opportunity to talk with us today and talk to us a little bit about, the physician burnout. I know you've been a cardiologist for so many years in various corporate and in your own private practice, and you've really seen this firsthand. So can you tell us a little bit about your experience and about physician burnout?
Well, Laura, thank you so much for having me on the podcast today. And yes, you're absolutely right. I know burnout firsthand. I've been in this profession for 20 years in the United States and more in my home country, Ukraine. I graduated medical school in 1990 when I was only 23 years old and proceeded working as a physician after that. Then we moved to Canada and subsequently to the United States, where I was, I had to be retrained as a physician. And interestingly enough, I did not have any burnout during my training, as opposed to many other trainees who start reporting burnout during their training in the United States. I was lucky, maybe within the first couple of months of my first year of residency in Virginia. But I attribute it to the adjustments time, when I was adjusting to the new environment, the new country, residence, and all that stuff. But rather than that, I was flying in my residency. I was flying through my fellowship at the Temple University Hospital. But then I started my first job as an attending physician, as a cardiologist attending on the main line of Philadelphia. And that was supposed to be a dream job. It was a perfect group, very well-established group in a perfect setting, a very nice area. I lived in this area before, a very cool hospital, very nice patients, nurses, and my family was around me. And interestingly enough, I did not like it. From the first month, something went wrong. As much as I loved cardiology, as much as I loved my practice and everything, loved my patients, I faced 14-hour work days, to be honest. And I could not get out of this. The longer hours I worked, it was just kind of self-perpetuated misery, to be honest with you. And I was still young. I was still in my, late 30s. And I kind of found myself very isolated in a group of, frankly, much older physicians, and I was the only female. I was much younger than everybody else in the group, and I found myself isolated, mentally, emotionally. I was unable to talk to anybody, to kind of pour my heart to somebody, or relate my feelings to anybody. And this is how everything started. 14-hour days weren't helpful. My family fell apart. My private life led to a divorce. And I found myself as a single mom with 2 kids, working that type of a job and getting more and more into a burnout, downhill spiral. So that lasted more than 3 years. And then I had an opportunity to change jobs to what I thought was actually a better work-life balance. So I went to work for industry, a non-clinical cardiology job for a large corporation. And I was in charge of a cardiology, cardiac safety department. I was a chief cardiologist, senior cardiology. Again, managing a large group of cardiologists there, working long hours. Eventually, I got myself into the same situation, only without taking calls on weekends and, on weekend, except weekend and night calls. I was working the same 12, 14-hour days. And that lasted somehow 14 years. I don't know what took me so long to get out of there, but it just sometimes when burnout, and the definition of burnout actually is kind of extreme emotional and physical exhaustion that is stemming out of stress, chronic stress. It could be stress related to physical or mental stress. And that's what I think happened to me. It was a combination of prolonged physical and mental stress that led to this exhaustion of all my physical and mental resources. And I was simply unable to spring out of it, to change anything in my life until I was able to do that. And that's another story, because I changed my life, and not only I moved on, I changed my life. I turned it around 360 degrees, or is it 180 degrees, right? And I was able to, completely eliminate burnout out of my own life, change my life and my work-life balance, change jobs, find a new purpose in life and in work, and help so many people around me to do the same.
Yeah, and I love that. And, one of the things I really enjoyed what you said there is, oops, sorry, I just clicked something wrong here. Oh, there we go. One of the things I really like what you said there is it was extreme physical and emotional stress. That's a lot. And, we were talking before on the call, and you were saying, how high the rates of physician burnout really is. I mean, I think a lot of times we think of burnout as a corporate thing. And I know that even with me, with the shift working professionals, we often don't think that our shift working professionals experience burnout, because I think so many times we have associated to corporate or executives have the burnout. But tell me a little bit, what are the rates of physician burnout?
Sure. It's interesting that you mentioned shift work and everything else that you are dealing with, with your profession and your field now. But in a way, physicians and medical professionals are shift workers, and starting with their training, right? Because they go and they are on call every so often, sometimes every third or fourth night in their training. So they are used to shift work. And that actually profoundly changes all the, the internal biological clock, and creates the milieu for stresses right away. So, but the interesting thing is that there are several profound reasons that physicians are prone for burnout, starting with their training. First of all, there is culture that predisposes physicians to burnout. And that culture starts with their medical school training. When we as physicians it's embedded actually in our training, it's drilled into our brains that we are machines in a way that have to be to have extreme endurance, right? We have to work extremely hard. And the empathy that we have is mainly towards patients. But it's not something that is encouraged to have empathy towards one another. That's number one. Number two is that our training perpetuates compliance and kind of discourages individuality. And also, we measure ourselves toward extremely high bars. Like, in cardiology, for instance, I remember we were thinking, how can we reach levels of those people like Eugene Braunwald or Helen Taussig, for instance, who are world authorities in cardiology, right? We don't measure, for instance, our successes saying more or a week ago, I was less smart or less knowledgeable than today. And today and tomorrow I will be smarter and more knowledgeable than I am today. We are measuring ourselves against huge, successes of other people, of other stars in our profession, and suppress our own emotions on a daily basis because it's not cool for a physician to be vulnerable. So all of this predisposes, and also it's learned behavior during our training not to take care of ourselves, to take care of patients first, but forget in a way about ourselves, our needs, basic physiologic needs, and psychological, of course, physiologic needs. It was a motto that they drilled in our heads during the residency. Pee when you can, eat when you can, and sleep whenever you have time or you don't, right? So that already gives you a background for something that it means a physician is not a human being in a way. Physician is a machine. So that's number one. Number two, there is a profound change in medicine, how medicine is conducted now, what medicine is all about, the ownership of medicine itself, right? So from private practices where physicians had full control over their destiny and over their decisions, now hospital systems and physicians are owned by people who have money and who can dictate to them what they have to do and how much they have to do to simply make money for the shareholders, for the stakeholders, right? So when physicians stopped being decision makers in this whole game, they simply became workforce, like everybody else. It's not necessarily a bad thing, but being decision makers for generations, this shift to being just pawns in the game okay, when you have no words, no, saying in the game whatsoever, and you can be told to see 40 patients per day if your administration wants you to, or 50 patients per day. It's completely humanly possible. You have no say in the game. So that creates a profound misalignment between physicians' internal or own values, why we went to medicine in the first place, to heal, to see patients face to face, to spend time, to hold hands, to heal, and the values of somebody else who puts us on that conveyor on the assembly line, right? And that actually creates a profound dissatisfaction with the state of our medical profession in physicians' heart, inside of our hearts. So that is number one reason for professional dissatisfaction, for burnout, that misalignment of values from physicians, between physicians and the owners of their practices.
That's really, that's really interesting how I took so many notes. I have little sticky notes everywhere right now. But one of the things, you said, it was really embedded in the culture of your training. And, I remember reading, it was in OSHA when I was working with some nurses, and they were talking about medical mistakes due to fatigue. And they were telling me about, I think it was actually with doctor trainings, but there was a training where you have to actually be like within the hospital system when you're doing your residency for like 36 hours without sleep. And it was, as they're telling me this, and one lady was actually telling me the story, and she's like, well, the guy that actually founded this, and you might know a little bit more as I'm talking about this, but he was actually addicted to cocaine, and he stayed up for so long. And he's like, well, if I can do it, then the doctors I am teaching,
everybody else can do that.
Exactly. And I thought that was insane.
First of all, I'm sorry, Laura, I forgot to answer your question about the rates of burnout. Okay, so before the pandemic, the rates were the self-reported rates, because there is no other way of knowing the real rates, right? So the self-reported rates were somewhere in mid-50s, okay, in mid-50s. That's what I call languishing. That's not really, because mental health is a continuum. Mental health is not a, static value. So we can go back and forth on the scale from 1 to 10 or 1% to 100%. We can deteriorate, right, as a group of providers, and we can get better. So 100% burnout is like everyone is in deep distress, and 0%, of course, everyone is elated, on their workplace. 58 to 60% is not good, but it's not horrible. During COVID, everything came to the surface and everything got exacerbated. Why? Because we, as a group of professionals, saw extremely it was thrown in our face how much how little we were valued, actually. Okay, and everything started with a lack of PPEs and all that stuff. So, but it was like a slap in the face that we were not valued as a group of professionals. We kind of suspected that, but it was kind of slap in the face. But so those numbers shoot up above 80s. So self-reported burnout now is 80 and above. Okay, so I actually did my own live study, just a couple of weeks ago. I was attending this tremendous American College of Lifestyle Medicine, meeting in Orlando. November 13 to 16. I am a co-chair of the cardiology group of the American College of Lifestyle Medicine. And I went there for several days to just, attend the meeting, to socialize with my colleagues, to present, etc. And I did my study on physician burnout right there with providers who were there. And we thought that these are the best adjusted providers because they are, versed in the art of lifestyle medicine, and they practice lifestyle medicine, and they know everything. No, the rate of self-reported, I actually collected data from almost 49 physicians. Only 4 people said they did not have burnout. The rest said, and the average grade was 7. The average grade was 7 out of 10. I was shocked. I actually published it on the college website and on other, in other outlets. So this is now, and this is in our best adjusted physicians. But going back to William Osler, he invented this residency institution. Residency mean resident from the word reside. Reside means to live where you practice or where you work. So those residents who were trained back in the day, they did not have any life. They were not paid. They were just fed in the hospital. They went there for 2 years to be trained. They lived there, on premises. They had just their lab coat on their shoulders, and that's it. They would sleep overnight, just wake up and go back to work, come back to their room, sleep a little bit, just go back. So that was the residency. Private life? What private life? You're not entitled to be private, to have any private life. You're a physician, you're a doctor, right? This is where everything went. So, and then back in the day, even when I was trained in the 90s, even at the beginning of 2000, we had no cap on the hours when we were on call. I remember vividly when I was in my residency, when I was in my fellowship here at the, Temple University Hospital in Philadelphia, the fellowship cardiology, we had no cap on our hours. We go on call, spend 24 hours on call, taking care of patients, sleepless night. The next day, we go until we finish. Sometimes I spend 36 hours, no sleep. How can you function in such condition? You can't function. Your brain doesn't function. And then every 4th night, you have to do the same. That's tough.
Yeah.
So, and especially if you finish with a debt of $500,000 on medical school and your husband or your wife, that sums up to $1 million. So, well.
Yeah.
Yeah.
That's crazy. Like, I remember hearing that story and I was like, seriously? Like, this was a thing? And
it's not just a story. It's not an anecdote. It's absolute true. And then, at the beginning of 2000, so at the beginning of this millennium, something happened. I don't remember exactly what happened, but in New York, in the state of New York, there was legislation. Something happened. There was a lawsuit. The medical mistake was made by a resident, and they put a cap, supposedly, on the number of hours. Well, whether this cap is followed or not, that's another story. We don't know. But I wasn't lucky we didn't have that. And generations of physicians before me didn't have that either. So
yeah, I definitely see what you mean, that it's embedded in the culture. I mean, if it's embedded in your training and it's just something that's promoted, and I can definitely see, and, I know from, the perspective of the importance of sleep. I mean, you sleep for less than 6 hours for 11 days in a row, and you have the productivity level of someone that hasn't slept in 24 hours.
Absolutely.
So you keep building and building, and through all the research, they have never found that there was a cap where it kind of just levels off. It never levels off. And it's interesting because I always think about, the Guinness Book of World Record. You can go in like a human flight suit out to the Earth's atmosphere and fall down through the Earth's atmosphere, and that's okay for the Guinness Book. but there
Yeah.
cannot be any studies done on sleep deprivation for the Guinness Book of World Records. I mean,
In
that just goes to
humans,
show you how important sleep is. And I mean, the Guinness Book of World Records won't even allow it.
not in humans, but there were some very unethical studies on mice or on animals that they did actually. I'm not sure whether it was in this country or in Germany, somewhere else. They did on animals, and animals eventually died from sleep deprivation. Animals died, and students and fellows who were, assigned to supervise those animals during sleep deprivation, they almost reported PTSD after that. They had recounts of their experiences that they had a very hard time supervising those animals because they were so, they felt
Wow.
for those poor animals, how they suffered, how much. Yeah. So it
That's
was
sad.
gradual decline, and then the gradual decline, and everything, the psychological and the mental, and then physical decline, and then they physically died. Yeah, yeah.
That's crazy. And you know what's
It's published. It's well known.
Yeah.
Yeah.
What's interesting is what you were saying about the Academy of Lifestyle Medicine is that, those highly trained physicians that are trained in, some more practices about, our lifestyle and more of a, I'm going to loosely term it healthy lifestyle, right? But they're more in tune to what, that health needs to happen and things like that, and sleep and mindfulness and stuff.
Right.
And that their experience extreme burnout. So what are some tips that we have for any physicians, nursing, anybody in the medical field, or anybody else listening that's going through some burnout? What are some things that they can do to help eliminate the burnout?
Yeah. So it's like sometimes, and the more I talk to people in the field, the more it feels, Laura, like it's an uphill battle. Okay. However, everything starts with the recognition of the problem, and during the COVID, I think that was triggered on a mass scale, that recognition of the problem. So the United States Surgeon General Vivek Murthy and the American Medical Association, they issued a statement that the health of the nation depends on the health of our health workforce. And the American Medical Association actually issued what is it called, AMA, or American Medical Association Recovery Plan for 2022 for American health workforce. Physicians as well. So that plan is complex, and they identified so many parties involved in eradication or mitigation of physician burnout. I mean, the parties that can make differences, okay, they range, literally speaking, from federal and local governments or state governments. I mean, we're talking governments, okay? Governments can make policy changes that affect certain things that, literally speaking, affect policies, how to conduct medicine that indirectly affect us. Insurance carriers and providers and payers also, especially those companies that make electronic medical records, also can do a lot of things for physicians and providers. And also, physicians themselves and family members who are identified as pivotal group of people who can do things. And especially workplaces. And let's talk about things that we cannot change now. If I, for instance, was working in a toxic work environment, right, and I was experiencing a burnout now, in hindsight, with all the expertise and experience that I have now, I would say, forget about the federal government, forget about insurance policies now. I need to do something now, right? And there are several things that can be done quickly and they can be done effectively. So in my opinion, and in the opinion of thought leaders in this field, and the thought leaders, I mean, such people as Dr. Tate Shanafelt, for instance. He is the chief wellness officer of the Stanford Medicine. Okay, I'm talking that caliber. He is the first in the country chief wellness officer. That's the official position that, in my opinion, has to be at every large healthcare institution. Okay, so we think that, number one, it has to be done most effectively on the level of healthcare institution by identifying individual needs of people in that very institution. It cannot be projected from other places. The funny thing that we can't just say, hey, we know what works at other institutions, you follow me, and implement it here, right? On the main line of Philadelphia, for instance, I cannot say what works for Stanford. Let's just grab the toolkit and implement it here. We really need to make sure that each and every organization learns their individual needs. And they need to make sure that when they identify their local needs, they have to establish leadership that includes physicians, includes those providers that have stake in the game. But first, how they learn about the problem, about the local needs. First and foremost, they have to listen to their people who work for them. Leadership is pivotal. Leaders have to breathe the same air that people breathe, listen and be submerged into the same atmosphere that their workers. They have to open their eyes and ears, and they have to listen to their workers' needs. It doesn't mean that if their workers list, number of problems from A to Z, and all of those problems, include 5,000, gazillion things to change. It can be changed tomorrow or the day after tomorrow. And if one of them costs $5,000 to change, one costs $0, and one costs $5 million, one needs to jump on $1 million change. Things can be done for cheap, but they can be done fast. So those things that can be done cheaper and faster need to be implemented first, but they need to be implemented sooner rather than later to make people happier sooner rather than later. And the leadership has to involve physicians and medical professionals. Without that, leadership feels like they're completely detached. You follow me?
Oh, absolutely.
People need to make sure that they're heard, they've been heard, and their needs, exactly what they need in this specific institution, being carried out. Would you agree with? That's
absolutely.
That's common sense. That's common sense. The best ways to learn is from the military. Actually, now medicine started learning from the military. The military has been acting under severe pressure, and so if one learns from the military team how they mitigate burnout fast, they have leaders who, literally speaking, talk to their people immediately after difficult situation and ask their people, how can we do it better for you? How can we do it different? Tell us what you think needs to be done. Instrumental, what needs to be done. How the team needs to be changed, what really went wrong, and what you think can be changed on different levels for this not to happen again. So this is what works. Workflows, teamwork, cafeteria food, spaces in the offices, schedule changes. Those things don't take much money to change, but those things make people extremely happy and change dysfunctional workplaces into functional workplaces. Because what happens at work, what happens at medical systems, they hear the word burnout and they run to implement resilience programs for people. Resilience programs is only 20% resilience of the equation. The rest of it is a dysfunctional workplace. Okay, the rest of it, 80% is dysfunctional workplace. If it's not addressed, if practice environment is not addressed by all those things that I just said, by effective leadership and merging with actual people who work with workers and representation of workers in leadership, nothing will change. In fact, the McKinsey Institute and Dr. Tate Shanafeld's research showed that the most resilient workers will leave the toxic work environment the moment they can. They will leave it. So, of course, is there a place for resilience training? Of course, there is a place for resilience training, but that should not be the emphasis. Well, the emphasis should be changing the toxic work environment with the help of your own people. Yeah. Listening to your own people.
And I think you make a really good point there is, when you're training your team in resilience, part of resilience training is to understand your boundaries. So you're training them in resilience to, understand their boundaries, to be able to bring themselves back around. But if you're not changing the actual organization, they're going to leave. And then you're left with just the ones that are burned out and not resilient. And I think that is a great point. And I love what you were speaking on about how we need to build a better system. And, if someone wants to get in touch with you, how can they get in touch with you?
Well, I am everywhere under Cardio Seeds. You can find my website, www.cardioseeds.com. I'm also under Cardio Seeds on the Facebook. My LinkedIn actually is under Svetlana Chamoun. So LinkedIn is under Svetlana Chamoun. I'm not on Twitter. I most recently left Twitter because I wanted to be together with those workers who were fired, but I'm thinking about going back at some point. And Instagram is also Cardio Seeds.
Perfect. And I'll have all those links in the show notes. And I'm with you. I'm not on Twitter. I've actually really never kind of been on Twitter, but I think it's great. And you have to have your boundaries with social media, right? But I just want to thank you so much for taking the time and talking to us about this. And, thank you so much. And I'll make sure to have all the links to your contacts. And guys, if you haven't listened to the Cardio Seeds podcast, I'll have a link over there. You can go and hear Dr. Chamoun every week. And, I just want to thank you for everything.
Laura, you're very welcome. Thank you so much for having me. Have a great holiday season. To you and your listeners. Thank you.
Thank you. And you as well.